Hello and welcome to the France 24 interview. Our guest today is Dr. David Nabarro. He is a professor of global health at London's Imperial College, and he is currently the World Health Organization's special envoy for COVID-19. He joins us from Geneva. Thank you very much for being with us, Dr. Nabarro.
Thank you, Mark.
Obviously, there are worrying signs about COVID-19. It's probably much better in Europe, let's say Western Europe, but it's getting much worse in the US especially. Are you worried today?
Yes. Do you know, to tell you the truth, I'm extremely worried because as I look at the numbers of new cases reported, they are climbing rapidly, accelerating, and they're accelerating all over the world. And so particularly in the Americas, that is from the United States through Central America into Latin America, also in South Asia, and increasingly in Africa, we see that the reported numbers of people with COVID is rising. In Western Europe, as the economies start to get active again and people travel, we know that there will also be increases. And the challenge will be the extent to which countries are able to contain outbreaks quickly and prevent them from becoming overwhelming. So my worry is the continued spread. My hope is that governments everywhere, together with their people, can just suppress outbreaks as quickly as possible before they become enormous.
Right. The problem with that is that no country has really fully succeeded in essentially making sure the pandemic doesn't rebound. That's a worry because some have used lockdowns, others have not, but there's no recipe for success. And that's also a worry, I guess.
Well, you say that, but I think what we have seen is that the countries that are able to put in place strong defenses at the local level are the ones that are able to deal with the rebounds really quickly and efficiently. It doesn't mean that they have none. It just means that they deal with them effectively. So we look at Australia in Melbourne, where there is currently quite a significant outbreak. And it's not nice for the Australians, but at least the response has been very strong and focused. Or we go to Singapore, where there's quite a lot of COVID in foreign worker dormitories. The authorities know what they're doing. It's a struggle, but they're getting on top of it. Same in Germany. So when we look at countries that are dealing with their outbreaks in a structured and systematic and thorough way, then we feel really rather pleased. The situations we worry about is where it seems as though the virus has just got the upper hand and we're just not able to control the outbreaks. And there, parts of the United States and other parts of the Americas are a real concern.
Right. Speaking of the United States, obviously there are countries where clearly the infrastructure is not there to cope with the virus. But you would think that in the US, there was enough information, there's enough means to deal with the epidemic. Why did they totally lose control, it seems, of it, despite the fact that it seemed more or less controlled just a few weeks ago? What happened?
Yeah. So there are three things here. First is it's really important that the people are fully on side with what needs to be done. This is a dangerous virus and it should never be underestimated. And we have to be rigorous about physical distance, about face protection, about isolating ourselves if we get sick, and about good personal hygiene. Now, if there's any inconsistency in the message, for example, between the head of state who might downplay the seriousness, whereas more local governments might be really asking people to take it seriously. But if there's any inconsistency, it creates real difficulty. So that's the second requirement, as well as people being on side, is consistency of communication. And thirdly, is having local organization to be able to deal with the virus. Interestingly, several of the more advanced nations who've got this virus do not have the capacity for strong local action with everybody integrated and coordinated to suppress outbreaks the moment they start. And so if we could encourage our friends in the United States, first of all, to get everybody onto the same page, secondly, to have consistent communications, and thirdly, to really build up local public health organization, then things could get better quite quickly.
Right, because the problem with Donald Trump, and the same applies to Brazil with Jair Bolsonaro, is essentially from the very top, there's always this notion that this is not serious, that the priority is restarting the economy, and I don't wear a mask, and so on and so forth. The message from the very top, some are saying that it's really sending the wrong message, especially at the time when the pandemic is spreading very fast.
Yes, I do ask every single world leader to take this virus seriously and not to convey to people that somehow you can just wish it away. Actually, it's not a choice between dealing with the health challenge and restarting the economy. It's both. If you get the health right, then the economy can restart. If you neglect the health part, then the economy will be perpetually vulnerable. So for me, at least, the message is clear. And I'm very impressed that there are a lot of leaders around the world who've come into line and who are saying very, very clearly, got to get the public health right in order to restart the economy. And then we've got business leaders, we've got community organizations, universities and others really saying the same thing. Our task now is to get the top leaders who've been making a bit of a reputation out of, in some ways, dismissing this virus. We've got to get them to come to the same position, because if they don't, they actually stimulate a tendency among some people to just treat it too lightly. And that'll be bad for the world.
Right. What do you make of the U.S. now official decision to pull out of the WHO right now? I mean, it takes a few months, maybe it takes a year to do so, but now yes, it has started. I mean, what message does it send?
Well, in health, we really do have to have spaces where people can come together and talk openly about what's happening without fear that they're going to get any kind of political pressure put on them to suppress information or whatever. And the really good thing about the World Health Organization is that it provides a safe space for health people to do this kind of thing. Secondly, it obviously has to work within a political context, but by and large, political leaders have given the technical teams in WHO the space to deal with issues properly, like Ebola, like influenza pandemics, like cholera outbreaks or other similar things. And the United States has been a really strong supporter of this approach to global health. So it's really disappointing that suddenly, right when we're in the middle of dealing with a really difficult situation, that the US says we're withdrawing. They're accusing WHO of being too nice to one particular country.
China.
But everybody needs to understand that actually the way in which WHO works is through countries agreeing to provide information. The WHO can't compel countries to provide stuff. So, of course, you have to be nice and friendly and pleasant and respectful to every single nation, because you want to get their information and you want to do it in a proper way. And that's what we do for everybody. We don't treat any country as though it's a favorite. We work for everybody. And that's the feature of WHO's working. So as well as being disappointing, it's also a bit hard to understand, because the United States needs the world to be able to get on top of this pandemic just as much as every other nation. So withdrawing is hard to explain. It would be hard for me to explain to any American that I know what on earth the United States gains from pulling out of WHO at this time. Afterwards, when we're doing all the evaluations, if WHO has done something terribly wrong, then I can quite understand countries saying, either we've got to remodel it or we've got to change the membership. But right now, when we're in the midst of the most extraordinary public health crisis ever, it seems really hard to comprehend.
Just a last question, quickly, Dr. Nabarro, we're running out of time. Some scientists have challenged the WHO for not taking into account the possibility of airborne transmission of the virus. They're saying you're not paying enough attention. What's your response?
Well, I'm really glad that we've got different groups actually coming out and saying, have you looked enough at this, or are you happy with that? Because that's what the WHO is. It's a place where we gather together all the science and we try to make sense of it. And one of the really big questions is the mode of transmission. All the evidence that we've seen suggests that it's droplets that come out of our mouths when we cough, when we sneeze, that travel about 1 meter. That's the main mode of transmission. But we've always said perhaps there are some smaller droplets that can get into the air and can be carried further. They might also have a role, but we don't know how important their role is. The scientists who've written to WHO are saying, could you perhaps consider that airborne might be more important? The WHO people are saying, yes, we do want to understand that. And the message to everybody is respect the physical distancing, but bear in mind that in some confined locations, it's possible that the thing can get airborne, and that means we have to be extra careful.
Dr. David Nabarro, I want to thank you very much for being with us here on the France 24 interview from Geneva. Stay tuned for more news.